Hello and welcome to my capstone and 5-year plan presentation. My name is Abiodun Adesemoye. This is Nurse 4580, Sentences of Professional Nursing with Lamar University. My professional biosketch. I have 10 years experience in healthcare. I started off as a CNA 10 years ago. In the process, I enrolled in El Centro College to ADN in nursing, and I graduated in December of 2016. And afterwards, 2018, I enrolled with Lamar University to earn my baccalaureate in nursing, which hopefully by December of 2019 is my completion. Now about my nursing experience. I was fortunate as a new nurse to have a nurse residency with the acute neuroscience unit in my facility, and I worked there as a neuroscience nurse for 2 years. I afterwards went to the medical surgical unit. Right now I work with patients that have behavioral or mental health issues, and I also float to all medical surgical fields as well. I am a 2-year active member of Skin Committee, which is one of the champions to Pathway to Excellence where I work. Basically, what we do is skin assessments. We do assessment on wound care and skin. Basically, I have a BLS, and I am hopefully will earn my RNBC after my certification with ANCC in 2020. The first construct here is Humanity and Society construct. The learning outcome will be practicing safe and effective holistic patient-centered care to a variety of patient clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. My reference for this will be the Student Handbook 2019. The course here is Nurse 4540, Nursing Practice, Care of Communities, Nurse 4550, Nursing Practice, Leadership and Management in Healthcare System. The assignments include civil pride and diversity. Discussed here is the Hospital Community Cooperative Initiative, which basically what they do is they did help with equity, patient equity. They help in advancing patient equity. Sorry about that. So the goal met here, and also I did do some practicums, project planning, windshield survey interview, and carried out some teaching plan and video on disaster preparedness with homeless adults. This is where I went to Eden homeless outreach, and I did talk to people about restoration from drugs, incarceration, addiction, and their road to recovery. I also gave them a teaching video. The goal met here would be 100%. Lifespan Health Continuum Construct. Here is a student learning outcome tool will be support patients, clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. The course here will be NOS 4316, which is Comprehensive Holistic Health Assessment. The assignments include Elder People 2020. I talked in relation to healthcare associated infections, class by, and then I touched on nursing theories as is adapted in guiding nursing process, where I talked extensively on the Newman system model. The goal met here was 100%. Learning outcome 3 will be to evaluate patient-centered care for patient clients across the lifespan based on common and complex health needs and compromise multiple health states when considering multiple determinants of health. The course here will be Nurse 4620, Nursing Practice Compromise Multiple Health States. The assignments involve discussions 1 through 5 and practicums 1 to 7. I touched on evidence-based teaching plan and theory advocacy for patients who have compromised multiple health states. And the favorite one that was a very Glaring in my mind still was the patient I talked to that had multiple sclerosis. I did talk about with her and discovered the impact multiple sclerosis had on her and her way of life. And I did some teachings and education. I taught her about integrating the vaccine carry model into practice so it could help her in her life. So the goal met here was over 90%. And next will be the evidence-based practice and clinical reasoning construct. The learning outcome here synthesizes clinical and judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. Nursing 4550, nursing practice, leadership, and management in healthcare system. The assignments involve practicums, discussion, clinical application paper. Overall, my clinical application paper entails identification of political changes in nursing practice, initiatives in improving qualitative healthcare while reducing cost. I also give an honest opinion on leadership and qualities and approach, and also an honest self-analysis on my own leadership qualities. The goal met here is over 90%. Patient-centered, patient-client-centered care construct. The learning outcome will be employ self-effective patient-centered care using theories and evidence-based findings in collaboration with patient clients and members of the interprofessional and intraprofessional healthcare team. Handbook still was the students' RN-based student handbook. My assignments, the class here will be NUS 4321. My assignments include discussions 1 to 4. 1 to 4 where I recognize current nursing philosophies, nursing meta paradigms, critical thinking. I also talk about the differentiated essential competencies in relation to nursing education and practice, where I explain nursing negligence. And like I said, I talked about nursing philosophies that has to do with meta paradigm, about the nursing practice, person, health, nursing, and environment. The goal met here is 100%. Professional roles, learning outcome 6. Differentiate multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patient clients as a member of the interprofessional and intraprofessional healthcare team. The course here is Nurse 4391, which is Nursing Inquiry and Evidence-Based Practice. Assignments include discussions, ethics in nursing attrition, theories in nursing research. I remember here that I talked about qualitative research. I did a critique on nursing burnout and resilience to include factors like moral distress, emotional exhaustion in nursing practice. The goal met here is over 90%. Learning outcome 7 talks about demonstrate professional integrity, effective communication, active inquiry, and service to the community. The course here will be NUS 4540, Nursing Practice, Care of Communities, NUS 4550, Nursing Practice, Leadership and Management in Healthcare System. Assignments include self-analysis on leadership qualities and management skills, professional nursing organization. I did peer interview at my place of work, and impact on vulnerable population. The goal met here was 100%. Next, I'll talk about my 5-year plan. Interestingly, I'll graduate by December 2019 with my baccalaureate in nursing. 2020, I intend to sit for my ANCC Med-Surg exam to earn RNBC certification. 2021, I intend to enroll in MSN-NP program, where I will specialize in nursing administration. For the next 2 years, I still will be in the program until 2023. 2024, I'll consider nursing administrative position in an healthcare system and intend to have my own hospice nursing. My reference here was the undergraduate RMBXN student handbook from the Lamar University website and the American Nursing Credentialist Center ANCC from their website nursingworld.org. Thank you so much for listening to me, and God bless you.